Namaskar. Welcome to my YouTube channel. Today we are going to discuss about AIMS Staff Nurse Previous Year Question Paper Part 4. Let's start. The below shown instrument is used in which surgery? Option A. Thyroidectomy. Option B. Abdominal surgery. Option C. Thoracotomy. Option D. Caesarean section. The correct option is option A. Thyroidectomy. The mask shown in the image is known as option A. Nebulization mask. Option B. Simple facial mask. Option C. Non-rebreather mask. Option D. Venturi mask. The correct option is option C. Non-rebreather mask. The pain management nurse follows the recommended protocol for preventing constipation when starting a patient on opioid by option A. Adding bulk fiber to their diet. Option B. Giving the patient enemas as needed. Option C. Increasing fluids and exercise. Option D. Using a bowel stimulant and stool softener. The correct option is option D. Using a bowel stimulant and stool softener. Which of the following is the correct measurement of the oropharyngeal airway? Option A. Tragus to angle of mouth or angle of the mouth to angle of mandible. Option B. Corner of mouth and angle of jaw. Option C. Tip of nose and angle of mandible. Option D. ALA of nose and angle of mandible. The correct option is option B. Corner of mouth and angle of jaw. Oropharyngeal airways used in which of the following patient? Option A. Unconscious. Option B. Semi-conscious. Option C. Conscious. Option D. All of the above. The correct option is option A. Unconscious. While administering medication to prevent error patient indications is done by option A. Patient tells his name, date of birth, check medication chart and check patient identification band. Option B. Patient tells his name, check medication chart and check patient identification band. Option C. Patient tell his name and check patient identification band. Option D. Patient tells his name, patient identification band. The correct option is option A. Patient tells his name, date of birth, check medication chart and check patient identification band. A 28-year-old female present with hirsutism and male-like hairs on body. Which test should do? Option A. FSH. Option B. LH. Option C. TVS USG. Option D. Progesterone. The correct option is option C. TVS USG. A G3P2 female had 2 caesarean sections. What is the risk of uterine rupture in this female? Option A. 2 to 3%. Option B. 5 to 7%. Option C. 10 to 12%. Option D. 46%. The correct option is option A. 2 to 3%. Which medication should not be administered in treatment of CSD in lumbar puncture? Option A. Anti-inflammatory. Option B. Steroids. Option C. Antibiotics. Option D. Anesthetic. The correct option is option B. Steroids. Cefuroxime sodium 1g in 50 ml normal saline NS is to be administered over 30 minutes to a client with an infection. The drop factor is 15 drops GTT per 1 ml. The nurse sets the flow rate at how many drops per minute? Option A. 22 GTT per minute. Option B. 25 GTT per minute. Option C. 28 GTT per minute. Option D. 30 GTT per minute. The correct option is option B. 25 GTT per minute. The healthcare provider is caring for a patient on a ventilator with an endotracheal tube is placed. What assessment data indicates the tube has merged too far down the trachea? Option A. Decreased breath sound on the left side of the chest. Option A high pressure alarm sound. Option C. Increased crackles auscultation bilaterally. Option D. Low pressure alarm sound. The correct option is option A. Decreased breath sound on the left side of the chest. Which of the following layers of the adrenal gland secrete glucocorticoid? Option A. Adrenal medulla. Option B. Zona glomerulosa. Option C. Zona reticularis. Option D. Zona fasciculata. The correct option is option D. Zona fasciculata. Which among the following is the sign of severe dehydration among infants? Option A. Anxiety and increased skin turgor. Option B. Drowsiness, depressed frontalla, and decreased skin turgor. Option C. Excessive crying and excessive thirst. Option D. Drowsiness, bulging frontalla, and decreased skin turgor. The correct option is option B. Drowsiness, depressed frontalla, and decreased skin turgor. Which options described orthopnea? Option A. Ability to breathe only in upright sitting or standing position. Option B. Slow breathing. Option C. Difficulty in breathing. Option D. Rhythmic waxing and waning to respiration. The correct option is option A. Ability to breathe only in upright sitting or standing position. The obstetrical assessment of the reveals 1. This is her third pregnancy. 2. Her first child was delivered at 38 weeks. 3. Her second child was delivered at 34 weeks. Calculate the GTPAL score. Option A 31101. Option B 31102. Option C 31111. Option D 32111. The correct option is option B 31102. Patient arrived at an emergency department after a road traffic accident. Pulse rate 127 bpm. Blood pressure is 90/56 with cold extremities. The nurse understands that the patient is at risk of which type of shock? Option A. Neurogenic shock. Option B. Hypovolemic shock. Option C. Spinal shock. Option D. Cardiogenic shock. The correct option is option B. Hypovolemic shock. When examining a patient who is paralyzed below the T4 level, the medical surgical nurse expects to find option A. Impaired diaphragmatic function requiring ventilator support. Option B. Flaccidity of the upper extremity. Option C. Independent use of the upper extremity and efficient cough. Option D. Hyperreflexia and spasticity of the upper extremities. The correct option is option B. Flaccidity of the upper extremities. Contraindication of liver biopsy is option A. Diabetic condition of the patient. Option B. Decreased activated partial thromboplastin clotting time. Option C. Increased activated partial thromboplastin clotting time. Option D. Immunocompromised patient. The correct option is option C. Increased activated partial thromboplastin clotting time. Normal blood pressure of the adults. Option A. 120/160 mmHg. Option B. 120/80 mmHg. Option C. 100/70 mmHg. Option D. 140/90 mmHg. The correct option is option B. 120/80 mmHg. The most preferred site of administration of intramuscular injection in children under 1 year is option A. Dorsogluteal side. Option B. Vastus lateralis. Option C. Ventrogluteal site. Option D. Deltoid site. The correct option is option B. Vastus lateralis. Please like and subscribe. Thank you.